So very good evening everyone, and we are here to discuss the questions of CNS today. Yes, just let me know if the audio and video is fine. CNS today. Yes, so let's begin with the first question. So raphe nuclei located in the lower pons and upper medulla, raphe nuclei located in the lower pons and upper medulla secrete, right? So it's an important question regarding the secretion of the neurotransmitter. So let's see this. Remember, serotonin is the answer here. The raphe nuclei, which is located in the lower pons and upper medulla, it secretes serotonin, right? And this serotonin has a role in supraspinal control of pain. Supraspinal control of pain. Remember, this raphe nuclei, they stimulate the dorsal horn, which releases enkephalins, right? Also the norepinephrine, which is not the answer here, but we should definitely be knowing, releases locus, is released from locus ceruleus, right? So this locus ceruleus is present in upper pons and it secretes norepinephrine, right? Norepinephrine. Yes, right. So what is the answer? Answer is none other than serotonin, right? Question number 2, distance by which two stimuli must be separated to be perceived as two separate stimuli is greatest as. That means, you know, this is the concept of 2-point discrimination. 2-point discrimination, right? 2-point discrimination. Yes, so this is a question about 2-point discrimination. So basically we have to know, remember what is 2-point discrimination? Minimum separable distance between 2 points so that I can feel them as two separate points. So what we do is, there is an instrument here which is available still in some colleges. This is known as Weber's compass. It has a scale like this, right? The instrument's name used to be Weber's compass. So basically what I'm going to do is, I'm going to keep on opening the limbs of the two limbs of the Weber's compass, something like this. As I keep on opening the two limbs, I will keep on asking the subject whether you are able to feel 1 point or 2 points, right? So wherever he tells me that he is able to feel 2 points, I will measure this distance which is present in between the 2 points, right? This distance I will measure. So I am asking you in the question, where is it greatest? Remember, greatest is at the back of the scapula, where it is around 65 millimeters or 6.5 centimeters, right? Minimum it is on the fingertips, which is only 2 millimeters. Minimum is on the fingertips, which is how much millimeters? Only 2 millimeters. So you have to know both the, this distances. Moving now on to question number 3. So a 20-year-old weightlifter is attempting to lift very heavy weight, which is around 180 pounds, roughly around 90 to 100 kgs, right? This he has never done before. As he attempts to lift this barbell with his weights, there is a sudden and complete relaxation of the muscles of the arm and forearm. and the barbell falls. So you must have seen in the Olympics or in the Asian Games, one fellow is there, weightlifter, who is trying to lift a very, very heavy weight. Suddenly what happens is arms relax and weight falls to the ground. So why has this happened? Or which sensory receptor is most likely to mediate the relaxation of the muscles when the tension is increased, right? So important question and a must know for the exam, especially remember in undergraduate exam, as we say, the answer is, this is actually what is happening is inverse stretch reflex. Inverse stretch reflex, right? So let's revise the inverse stretch reflex here. This is, let's say, my spinal cord, right? Central canal, only one side I need to represent here. This is my muscle fiber, right? This is muscle fiber. We have the receptors present like this. These are known as GTOs, Golgi tendon organs. They are around 3 to 25 per tendon. That's an important question. Then the afferent fibers enter from the Golgi tendon organ. These are 1B fibers. Remember Lloyd and Hunt sensory classification. And the stimulus for this reflex is a powerful stretch. Please remember that it is not a light or passive stretch. That is muscle spindle. This is powerful stretch or increase in muscle tension, right? Golgi tendon judges tension, right? Powerful stretch or increase in muscle tension is the stimulus. Now as soon as the 1B reaches the dorsal horn, it will now go to the ventral horn, and immediately in the ventral horn it will synapse with a inhibitory interneuron. This one is known as inhibitory interneuron. This releases glycine. We all know glycine is an inhibitory neurotransmitter. So now my question is, what is this glycine going to do to your A alpha or the lower motor neuron which was supposed to stimulate the muscle? So will the muscle contract or will the muscle relax? So I think we will all agree this A alpha motor neuron is inhibited now, and the muscle is going to not contract but relax. So what is the response observed? Relaxation of the muscle. How is it helping this weightlifter, right? Remember, if I'm trying to lift a very heavy weight, suppose with my biceps contraction, and suddenly the weight is too much, my Golgi tendon organs and the biceps brachii tendon judges that is too much for you. I keep on lifting more and more and more. Suddenly the weight will fall to the ground. So how is it protecting me? This prevents rupture of the tendon. This prevents rupture of the tendon. How many synapses can you see? Another very important question. So you can see, let's see the first one, 1 and the 2. So how many synapses? The answer is none other than bisynaptic reflex. So sometimes they ask this as that explained by synaptic reflex, right? So you have to write the inverse stretch. What is the meaning of stretch reflex? Contraction of the muscle in response to stretch. What is the meaning of inverse stretch? Relaxation, right? So muscle spindle is not the answer. That is for stretch reflex. Joint proprioceptor is for joint and position sense. Pexinian corpuscle, I have given you one more question where we will discuss. Pexinian is for the deep pressure and vibration, fast vibrations. Moving on to question number 4. All except the following factors increase the cerebral blood flow. Another very interesting question. So remember that whenever you increase the CO2 partial pressure, which is known as hypercapnia, this is the most potent vasodilator of the cerebral circulation, right? Most potent. More is the CO2 partial pressure increases, hypercapnia, more will be the increase in cerebral blood flow. Local increase in potassium also increases cerebral blood flow. What is CBF? Cerebral blood flow. More is the activity of the cortical neurons. Suppose I am thinking about something, right? That I have to perform an activity, I have to go somewhere. So as you keeping on thinking, doing a lot of mathematical calculations, your cortex will need more blood. Your cerebral blood flow will be increasing. So increase mental activity, increases cerebral blood flow. But the answer here is option number D. Why? Because remember, very important concept. That's an independent question as well. Auto-regulation of the cerebral blood flow. Auto-regulation of the cerebral blood flow. If I make a graph like this, this is cerebral blood flow, this is MAP, mean arterial pressure. Please see this. We find that the mean arterial pressure is increasing, but within a range, the cerebral blood flow remains same or constant. This is known as autoregulation. This autoregulation of cerebral blood flow is seen in the mean arterial pressure range of 65 to 140 millimeters of mercury, right? What does it mean? If you decrease the partial pressure from 120 to 90, because it is being auto-regulated, the cerebral blood flow remains same, it doesn't decrease, right? Moving on to question number 5. What is the reason for auto-regulation? Myogenic theory, right? The most important one. Then metabolic theory. Which of the following describes a connection between components of the basal ganglia? That means you have to identify that which one is the correct one here. So let's start with the first one. Subthalamic nucleus releases glutamate to excite the globus pallidus internal segment. This seems to be correct, but let's read up the other ones. Substantia nigra pars reticularis releases dopamine. No. This releases GABA. Dopamine is released by Substantia nigra pars compacta. So this is wrong. Striatum releases acetylcholine to excite the substantia nigra pars reticulata. Remember, major neurotransmitter of the striatum is not acetylcholine, but 5% of the striatal neurons release acetylcholine and somatostatin. But naturally, this is not going to excite, rather they inhibit. So this is also wrong. Globus pallidus external segment releases glutamate. No. This is again inhibitory. It releases GABA. So this is also wrong. So the only correct answer here is the subthalamic nucleus releases glutamate. Remember, subthalamic nucleus is the only excitatory structure. It is the only excitatory structure of the basal ganglia circuit, right? Only excitatory. Let me quickly revise with you the direct and indirect pathways of basal ganglia, although we have dealt it in the main videos, but still I will revise with you because a lot of people have problem in understanding this. So this is an excellent picture to describe the direct and indirect pathways. So let me take you to the first thing here, which is so what I see here is, remember, this is the cortex, which is the motor and the premotor areas. Motor and the premotor areas of the cortex, right? So they are sending the afferent fibers to the striatum. What is striatum? Caudate plus putamen, right? In anatomy you study corpus striatum, that includes globus pallidus also. There are two pathways from the striatum. Let's quickly revise. We have the direct pathway. Remember, if you have to go somewhere, then you always open the Google map, because direct pathway means shortest channel, shortest route. So direct pathway takes me straight away to globus pallidus internus and substantia nigra pars reticularis. But these two, via the GABA which they release, they inhibit the globus pallidus internus and substantia nigra pars reticularis. Now both of them are already releasing GABA and were inhibiting the thalamus. Which nuclei? Motor nuclei, ventrolateral, ventroanterior. So very simple question. I inhibit both of them, which was already releasing GABA. That means GPI and SNPR. Now once I inhibit them, will they release more GABA, less GABA? They will release less GABA. So what happens to thalamus? Excitation or inhibition? Excitation. So what will thalamus do to the motor cortex? Thalamus is going to excite the cortex. That means direct pathway is always stimulatory. Direct pathway is stimulatory. Moving on to indirect pathway. Please see once more. Indirect pathway is, let's say this one. This is indirect pathway, longer route, many relay stations. So first one, indirect pathway releases GABA and it inhibits globus pallidus externus, which was again releasing GABA, which was inhibiting subthalamic nucleus. Let's pause here. What will happen to subthalamic nucleus? Yes, double inhibition. Two negatives make a positive. Subthalamic nucleus excites. This releases glutamate. What will glutamate do to these two structures? Excitation. What will they release on getting excited? GABA. What will they do to thalamus? Inhibition. That means what will thalamus do to cortex? Inhibition. So what is the net output of the indirect pathway? Inhibition. Inhibitory, right? Now that is confusing through the cortex. One pathway is asking the cortex to do the movement, another one is stopping the cortex to do the movement. How will the cortex respond? Thankfully we have the molecule which takes care of this, and which we all know goes by the name dopamine. So substantia nigra pars compacta, it releases dopamine. What will dopamine do? Dopamine acts via its two receptors on the striatum. When the dopamine acts via D1, it stimulates the direct pathway. When the dopamine acts via D2, it inhibits the indirect pathway. What does it mean? Let's see this. If dopamine via D1, think about it, stimulates the direct pathway, your stimulation will increase or will it decrease? Already direct pathway was stimulating, so stimulation increases. But see this carefully now. The same dopamine via D2 inhibits the indirect pathway. Now think about it. If I inhibit the indirect pathway, what will happen? If I inhibit the indirect pathway, it is going to, yes, what was indirect doing? Inhibition. So will there be more inhibition or less inhibition? There will be less inhibition. That means the net output becomes, in a normal person, the net output is always stimulatory, right? Remember that. So let's move on to the next question now. The primary motor area for shivering is, very important question again. The answer is none other than posterior hypothalamus. Remember, posterior hypothalamus is activated whenever you go to a cold weather place. So if this is my fellow who has gone to a cold weather place where temperature is 4 degrees Celsius, remember his body temperature is 36.8 plus minus 0.4 degrees Celsius. This person will start losing heat. Via which main mechanism? radiation, because there is no contact, there are no water currents, no conduction, no convection. As this person starts to lose heat, naturally his core body temperature will fall. What is the meaning of core body temperature? Core means central part of the chest. As it falls, this information goes and stimulates his posterior hypothalamus. Posterior hypothalamus will trigger shivering and vasoconstriction. As I do shivering and vasoconstriction, naturally the core body temperature will return back to normal. Which type of feedback? Chapter 1, negative feedback, right? Anterior hypothalamus, on the other hand, is activated in hot weather, right? Hot weather. Anterior hypothalamus will trigger sweating and vasodilation. Sweating and vasodilation, right? Let's move on to question number 7 now. What type of aphasia is seen in damage to area D? Very interesting question. What type of aphasia is seen in damage to area D? This is a very interesting figure and good question, because here you have to remember the areas for me. I am asking you this area, right? D. So this is located in the supramarginal gyrus, in the upper, in the part of temporal lobe. So this is nothing but my which area? Wernicke's area. Had you been able to identify it, so supramarginal gyrus, right? Let me show you another figure here. Please see this. Just a revision. Location of the various language areas. Remember, this is the arcuate fasciculus, right? This, what I had given you, is the Wernicke's area, angular gyrus and Broca's area, right? What is aphasia? Loss or impairment of spoken or written language due to lesion in the brain. This is Wernicke's area. Area 22, mainly for comprehension. Angular gyrus, naming area, and arcuate fasciculus, the bundle of fibers which connect the Broca and Wernicke. Let's move on to location. Broca's area, inferior frontal gyrus. Wernicke area, supramarginal gyrus in the parietal and upper part of temporal lobe. Now let's come back to the question. So here the Wernicke's area is damaged. I think all of you know the answer now. What will happen? Wernicke's aphasia. Broca's will happen where? This is Broca's area. Right, so here basically the Wernicke's aphasia, better answer would be, if I change this question to area A, that would be better. So maybe we can shift it to this one. Yes, this is actually the better one, and this is Wernicke, and D I can make as angular gyrus. So let me change this. D becomes your angular gyrus. And angular gyrus will cause anomic aphasia, inability to name. So in the lesion of angular gyrus, if you show me a visual picture, if you show me a picture of a dog or anything, and you ask me which is this animal, I will not be able to identify. I will not be able to name properly, right? Conduction aphasia, again angular gyrus. Sorry, conduction aphasia, as we say, the arcuate fasciculus lesion. Broca's lesion of Broca's area, and Wernicke's area 22, comprehension area. Let me show you a very interesting thing. What are the main features of different types of aphasia? So just a summary of the things. So Broca's aphasia, Wernicke's, conduction and global. Remember, Broca's area commonly occurs due to the damage to superior branch of middle cerebral artery. Wernicke's is inferior branch, again of MCA, middle cerebral artery. Now let's come back here. In Broca's, my speech area is affected, right? So what will happen? Yes, area 44, Broca's area, non-fluent. The person is not able to speak fluently, but comprehension is largely preserved. Repetition is impaired. That means because he is not able to speak properly, his repetition is impaired. Wernicke's aphasia, the speech is fluent, but comprehension is impaired. Comprehension is impaired, again repetition is impaired. Conduction aphasia, comprehension is largely preserved, speech is also fluent, but only repetition is impaired. Why? Because the bundle angular, the arcuate fasciculus fibers are damaged. And global aphasia means widespread damage to the brain areas. So if there is a widespread damage to the brain areas, then what is going to happen? All the areas are damaged or affected. So non-fluent speech, impaired comprehension, impaired repetition. Let's see if I show a picture of chair to a person who is having different kinds of aphasias, how will he represent, or what will he say, or what should be his speech like? So the area 44 Broca's aphasia patient, on seeing the chair pictures, will tell you this is SARE, that means non-fluent speech. The fluent speech aphasia or the Wernicke's aphasia will say stool. That means he is not able to tell chair because his comprehension is impaired. So he says stool, table, or he says cos. What is cos? Neologism, using new words for already existing words. This is famously known as jargon aphasia. So speech is full of unintended production of words or syllables as the person is speaking. Fluent, again conduction aphasia, areas 40, 41, 42. Sometimes we say, now the person is saying flare, swear, tware, that means rhyming words of chair, but he is not able to speak chair. And anomic aphasia, angular gyrus, area 39. This will say that I know, what is it? People sit on this. Yes, I have seen many in my office, many in my hospital. But I have many at home also, but he is not able to name that it is a chair, right? So very interesting presentation. So again, I have modified the question slightly here. If I have changed it to A, because A is Wernicke's, D is angular gyrus, right? B is Broca, and C is naturally the arcuate fasciculus. Let's move to the next one now. So next question is question number 8. The thalamic nucleus associated with olfaction. This is a very important question, and most of you should know it, that it is VPM, venterio posterior medial. Remember, VPL is the relay station for the somatic sensations, pain, temperature, proprioception, fine touch, tactile localization. LGB is in the visual pathway. Lateral geniculate body, medial geniculate body is in the auditory pathway. Midline nucleus is the non-specific, along with intralaminar nuclei. Non-specific means they are always stimulated irrespective of the sensation passing through the thalamus, right? Moving to question 9. Tickling and itching is transmitted by which tract? Another important question. You should definitely know all the sensations carried by various tracts. Remember, the answer is none other than, yes, anterior spinothalamic tract. Crude touch, itching, tickling, right? Posterior column, fine touch, vibration, tactile localization, stereognosis. Lateral spinothalamic, pain and temperature. Spinocerebellar, please remember, unconscious proprioception, something you are not aware about. Unconscious proprioception, right? Lateral spinothalamic is always pain and temperature. Moving to question number 10. Which of the following is true about visceral pain? Remember, visceral pain is the slow pain. We have a fast and a slow. So it is not going to show rapid adaptation. It's a slow pain. It is not mediated by B fibers, it is mediated by C fibers. And yes, it is poorly localized. It is diffuse, slow aching pain, poorly localized. and it resembles fast pain. No, it doesn't resemble fast pain. The fast pain, remember, is mainly by mechanical and thermal stimuli. Slow pain is usually due to chemical stimuli, inflammation. And please remember, slow pain is via C fibers because A delta fibers do not innervate the viscera. Let's move to question number 11. Weber-Fechner law is related to. This is a law of intensity discrimination which simply states M is equal to K into log to the base 10 I upon I0, where remember the M is the magnitude of the sensation perceived. It is the magnitude of the sensation perceived. That means simply I would like you to know that magnitude of the sensation perceived is related to some power of log to the intensity of stimulus. Intensity of stimulus. This is the threshold intensity, right? IO or I0. So the answer is none other than intensity of stimulus, right? Moving to question number 12. Which area relieves pain due to the massage therapy in the histology section image given below? So this is a wonderful question integrating the physiology with anatomy. So remember, the massage therapy is based on the concept of gate control theory of pain. This is what is being asked here. Gate control theory of pain. And the gate control theory of pain requires a lamina 2 which is present in the dorsal horn. So the best answer here is none other than A, right? Dorsal horn. Let's briefly recap the gate control theory. This is the dorsal horn. This is the ventral horn in the enlarged view. This is, let's say, the pain fibers. These pain fibers, they enter via C fibers and they enter into lamina 2. Remember, lamina 2 is also known by the name substantia gelatinosa. Now these fibers cross and will go to the other side, which is your VPL of thalamus, right? Now if you stimulate simultaneously the pressure and touch fibers, which are A beta, remember they will go straight up, they do not synapse in the dorsal horn. These are which one? A beta. Now they give a collateral to the lamina 2 and stimulate substantia gelatinosa, which on getting excited releases enkephalins. E for enkephalins. Enkephalins are the pain inhibiting substances. These enkephalinergic neurons cause presynaptic inhibition of pain. They cause presynaptic, some people say also postsynaptic inhibition of pain as well. Presynaptic means before the entry of C fiber, right? And postsynaptic will mean after the entry, like this. So these ones, they inhibit, mainly they do presynaptic, but they cause, as we now say, both presynaptic and postsynaptic inhibition of pain. So again, let's see, important point is lamina 2, substantia gelatinosa. What does it release? Enkephalins. And please see this, enkephalinergic neurons. What are they doing? Presynaptic inhibition of C fibers, and also the postsynaptic inhibition of the fibers. So they are doing both pre and postsynaptic inhibition, right? Pre and postsynaptic inhibition. So this is the encephalinergic neurons. This is the encephalinergic neurons. They are inhibiting both pre and postsynaptic pain fibers, right? Pre and postsynaptic inhibition. But definitely if you inhibit presynaptic, you can understand that our major part of the job is done, because the fibers, as they were entering lamina 2, they will not be able to pass. That is why we say the lamina 2 or the substantia gelatinosa behaves like a gate, right? It behaves like a gate. Lamina 2 behaves like a gate. If the gate is open, then the pain occurs. If the gate is closed, then no pain occurs. When will the gate close? When you will do presynaptic inhibition, right? That is why it is considered the main one. Although the book said that it does both. Now let's move on to question number 13. How this can be stimulated? All right. मुझे देख के बताइए और कौन सा दूसरा माइक मंगाना है, मैं लगा दूंगा, ठीक है. So what we see here is the flexor withdrawal reflex, which is a polysynaptic reflex, and its center is in the spinal cord. Let me quickly revise with this what happens in this one. Suppose you are walking barefoot like this. This is your, left leg and this is right leg. So as you are walking like this, suddenly my left leg lands upon a pointed sharp object. What will I do? I will flex my leg so as to remove the limb away from the painful stimulus. But simultaneously, I will extend my other limb to protect me from falling down. That means to maintain balance. So let's see the reflex arc of this one. This is the ipsilateral limb. This is the contralateral limb. As soon as the limb lands up on the pointed object, these are the nociceptors, which are pain receptors, which are stimulated, right? So the afferents are FRA, which are known as flexor reflex afferents. The fibers are type 3 and type 4. They enter Just see this, please follow this. They enter and they divide into many branches. What will it do? It will now first stimulate a neuron which is going to cause stimulation of your flexor muscle of the ipsilateral limb. Remember, pointed object, I have to flex my limb. But if I want to do flexion of my ipsilateral limb, what will I do to extensor simultaneously? Inhibition. So this inhibition is done via this neuron, which will inhibit again the A alpha motor neuron, which was stimulating the extensor muscle. So my simple question is, what will happen to extensor muscle? Extensor muscle is inhibited. But what will happen to flexor muscle? Contraction. So what is the net result? My ipsilateral limb will flex. But what do I want to do? Contralateral limb. I want to extend it. So let's see that. This is a commissural interneuron. Written over here, commissural neuron, which passes through the central commissure. This again gives two branches. Now this time I stimulate the extensor muscle. I stimulate it so that I'm able to extend the limb. But what will I like to do to the flexors of the contralateral limb? Inhibition. How will I do so? Again, this is a neuron which will inhibit and cause inhibition of the flexor muscle. That means ipsilateral limb will flex, contralateral limb will extend. Right? So very important reflex arc. Let's move to the next one. Circadian rhythm is controlled by which hypothalamic nucleus? The answer is definitely a must know. It is none other than suprachiasmatic. Remember, normally if you are sleeping every day at, let's say, 11 p.m. and waking up at 6 in the morning, so your body clock or your rhythm is set. Who is setting this? Suprachiasmatic nuclei, which is being controlled by, yes, pineal gland, which releases melatonin hormone. So what happens is, if you are sleeping at the same time, waking every day at 6, and you are setting an alarm in your mobile, right? Snooze. So now after 2 or 3 weeks, you will realize that you will start waking up yourself without even the need of an alarm. What happens? Your body clock is set, right? Moving on to the lateral nucleus of hypothalamus, option number B. Remember, ventrolateral is for thirst, hunger. Ventromedial is for satiety. A new seizure drug is being investigated that binds to and activates GABA receptors in the CNS. During their experiments, a researcher uses a microelectrode. He records RMP of -70. Which of the following membrane potentials is likely to be recorded following exposure to this drug? Remember, I only want you to know that GABA A and C have inotropic receptors which cause increased chloride influx. More chloride influx means hyperpolarization. So what is the answer? -75. Let's move to next one. Which of the following describes the functional role of the lateral hemispheres of the cerebellum? Very quickly, I will revise the cerebellum with you all. Just see this. This is, let's say, a representation of the cerebellum. Then we have a central part or the medial most part, which is known as vermis, right? We have a part adjacent to the vermis, which is known as paravermis. The vermis plus paravermis, remember, constitute your spinocerebellum, right? Vermis is in the medial most part. It will receive the proprioceptive input from the trunk, axial muscles. So who will control and coordinate the movement of the axial muscles? What is the answer of this first choice? That is the medial lobe or the vermis. Right? What is the answer for second one? Who will control the distal limb muscles? Yes, please tell me quickly. This is the intermediate lobe in between the medial and lateral, paravermis. Finally, let's move to the answer. Option number C. Functions with cortex to plan motor movements. Yes, this is this part, which is none other than the lateral hemispheres. This is my cerebrocerebellum, also known as neocerebellum. This is helping in planning and programming of movements. This is the answer. And finally, who maintains and coordinates the visual eye movements, visual balance and equilibrium? This is the flocculonodular lobe, which receives the information from the vestibular nuclei. Both afferents and efferents are from same, which is this lobe, flocculonodular lobe. What is which part of cerebellum is this? Vestibulocerebellum. Vestibulocerebellum, right? Also known as, aka also known as vestibulocerebellum, right? So what is the answer? C. Let's move to next one. Next question is, which structure serves as an alternate pathway for signals from the motor cortex? Remember, when I'm talking about alternate pathway, that means this can also stimulate the same motor neurons which the motor cortex stimulates. So cortex stimulates which neurons? A alpha motor neurons, mainly of the upper limb flexors. So which is the other tract which also stimulates the upper limb flexors? Amongst the choices here, the answer is only rubrospinal tract, which originates from red nucleus. So rubrospinal tract also stimulates the same one. But please remember, it's an excellent question. Why? Because this normal tract which originates from the cortex, you all know, is the lateral corticospinal tract, right? CST, which is stimulating this. This is a pyramidal tract according to anatomy, right? This is pyramidal. But please remember, the rubrospinal tract is not pyramidal tract. It is one of the, aka also known as extrapyramidal tract. So if I ask you which is the only extrapyramidal tract which behaves like a pyramidal tract, the answer is rubrospinal, right? Let's move to question 18. Sensory receptor potentials are action potentials. No. They will produce action potential when they will reach the threshold potential. What is the threshold potential in a neuron? -55. So they are action potentials? No. They are graded responses? Yes. Graded means directly proportional to stimulus strength. All or none is obeyed by action potential. Always bring the membrane potential towards the threshold? Not always. It depends. What is the stimulus? So not always. Right? Question 19. And this already I've explained you in detail. Encaphylinergic interneurons that are most likely to inhibit the afferent pain signals are found in which of the following regions of the central nervous system? Yes. Lamina 2 releases dorsal horn. Lamina 2, substantia gelatinosa. Moving to question number 20. A 71-year-old man comes to the physician's office with complaints of trembling in his hands, difficulty walking. Neurological examination shows the patient has a resting tremor of the left hand. During passive movement of the left arm, the muscles are rigid, causing cogwheel motion. What is cogwheel motion? If suppose this is the patient's arm and you want to flex it, so you will have very high resistance initially, then the resistance goes away, then again it increases. So it is like a cogwheel. Cogwheel is a wheel which we turn to thresh the grass in the villages. That is a cogwheel. Patient's facial expressions are reduced. While walking, the patient has difficulty taking the first step. He has a shuffling gait. All this is telling me that this is none other than a characteristic history of Parkinsonism. And now you all can think about it. Parkinsonism is due to the lesion of substantia nigra pars compacta, right, which releases dopamine, right? So moving on to 21. Which of the following is an encapsulated receptor found deep in the skin throughout the body as well as in facial layers, where it detects indentation of the skin, pressure and movement across the surface, vibration. So please remember, the one which detects deep pressure located deep inside the skin and vibration, fast vibration, is none other than Pacinian corpuscle. Pacinian corpuscle detects fast vibrations and deep pressure. It is the most sensitive receptor. Meissner's is most numerous, but it is mainly located in glabrous skin, non-hairing. Free nerve endings detect crude touch, pain, temperature. Ruffini endings, again mainly useful to detect sustained stretch. Now moving on to question number 22. Which of the following innervates the extensor A alpha motor neuron? Extensor A alpha motor neuron. Interesting question. Yes, you think we can probably find out the answer. We know these two stimulates mainly A alpha motor neurons, mainly of the upper limb flexors, right? So these are not the answer. Reticulospinal tract, remember, are of two types: pontine reticulospinal tract and medullary reticulospinal tract. Remember, the pontine is originating from the pons and they stimulate A gamma motor neurons of the extensors. A gamma. Remember, A gamma is not supplying your muscle, it supplies the peripheral portions of the muscle spindle. But medullary reticulospinal tract, it goes and inhibits the A gamma extensors. But remember, the pontine is tonically active. Tonically active का meaning होता है हमेशा active रहेगा, unless and until I inhibit it. So the cortex keeps it inhibited, otherwise it is always tonically active, right? So the pontine is the main one because it is tonically active. So this is A gamma. The answer is of course vestibulospinal tract. The reason is this originates from vestibular nuclei and stimulates the A alpha motor neurons of the extensors, right? So let's move to question 23 now. Which of the following neurons of the cerebellum releases or secretes glutamate? Please remember, the cerebellar cortex has three layers: outer layer, middle layer, inner layer. Outer molecular layer, basket and stellate cells. Middle layer, Purkinje cell. Inner layer, granule and Golgi. So there is one more cell, Purkinje. Amongst these, only the granule is excitatory. Granule is only excitatory cell because granule releases glutamate, right? Remember that, very important one. Now moving on to question 24. Which of the following parts of the body has cortical motor neurons with the largest representation of the primary motor cortex, area 4? Remember, we are asking you indirectly here, motor homunculus. What is motor homunculus? More complicated movements have higher representation in the motor cortex. Let me show you one picture, and I'm showing you both motor and sensory together. Just see this. In the motor homunculus, if you see the face portion, the muscles of the face portion, this facial area, it has very high representation. Why? This entire one, swallowing, so muscles of vocalization, as we speak. Salivation, mastication have very high representation. Look at the size. Look at the hands of this person. Very high representation. So hands and fingers also have very high representation. One of the highest. But the least representation, remember, in both of them is for the trunk and the back portions. Trunk and the back. Please look at the sensory. So in motor we say more complicated movements have higher representation in the motor cortex. In sensory we say more sensitive areas have higher representation in the sensory homunculus, sensory cortex. More sensitive areas. Which areas are more sensitive? Remember, my face, lips, tongue, hands and fingers. Again, they have very high representation. Look at the hands, face. And least representation, again same, trunk and back, right? Let's move on now to next question. So what was the answer? Yes, we didn't talk about the answer. What should be the answer here? Fingers, right? Best answer. Moving on to the last one. Which of the following is a characteristic of nuclear chain fibers? Nuclear chain fibers. Remember, nuclear chain fibers are a type of muscle spindle. They are not extrafusal, they are intrafusal fibers. They detect steady muscle length. Yes, is that correct? They detect steady muscle length. Remember, nuclear chain fibers show the static responses of the spindle. Static response. What is static responses? Static responses means they detect the change in length, steady length, not the rate of change of length, not the velocity of length. Who does that? That is dynamic fibers or nuclear bag dynamic. So dynamic responses are, they detect rate of change of length, rate of change of muscle length. So second seems to be correct. Let's look at for the other options. They give rise to group 1B afferents. No. They give rise to, yes, nuclear chain. They give rise to type 2 afferents. They are innervated by A alpha. No, they are innervated by A gamma. A gamma, not alpha. So the correct answer is option number B, right? Option number B. So revise these important topics, right? And good luck for the exam. Until I meet you the next time, take care all of you. God bless you all.